Download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Let's look at today's daily bulletin. The Director General of Health Services, that is a DGHS, informed the Madras High Court that the time limit for the admissions for National Eligibility Cum Entrance Test postgraduate medical admissions in 2022 for both All India quota and state quota stands extended up to January 14th. The DGHS submitted this before Justice C.V. Karthikeyan of the Madras High Court. The UGC has asked universities across the country to formulate a mechanism that will help students in pursuing two full-time academic programs simultaneously. The Commission introduced the guidelines for pursuing dual degree programs in April 22. In a recent notice issued by it, the UGC has directed university authorities for devising mechanisms that facilitate students to pursue two academic courses simultaneously. Medical and Health Minister Vidadla Rajani has said that the state government and CM Jagan Mohan Reddy aim to provide quality-free medical treatment to all. After inspecting the construction work of the Kidney Research Centre and also holding a review meeting with the officials in Srikakulam on Tuesday, along with Minister Sideri Apala Raju, Medical and Health Principal Secretary Mova Tirumanala Krishna Babu and Medical and Health Commissioner J. Nivas, she interacted with the kidney patients at Haripuram Dialysis Centre. In the wake of Atal Medical Research University Mandi failure to detect forged documents produced by students during counselling to secure admissions in MBBS course, people and medical aspirants have demanded that there was an urgent need to strengthen the checking system to detect such mischiefs at the primary stage. A section of government doctors in Bihar, not promoted for over a decade, contend that any new lateral entry at senior positions will affect their career progression. The Bihar government's decision to appoint faculties in super speciality departments of its medical college hospitals through lateral entry on the basis of an open advertisement will have to stand legal scrutiny, as a section of government doctors not promoted for over a decade have decided to challenge the advertisement in court, said the aggrieved doctors.
Opioid use disorder, or OUD, is a serious illness that is characterized by a person's compulsive use of opioid medicines despite wanting to stop, or when doing so has a detrimental impact on their physical or mental health. Current guidelines recommend that pregnant women with opioid use disorder be prescribed either methadone or buprenorphine. But these drugs too have significant potential for abuse. A recent study published in Acta Obstetricia et Gynecologica Scandinavia indicates that combination therapy of buprenorphine and naloxone, which is known to help to prevent such abuse, is as safe as buprenorphine alone during pregnancy for both mother and newborn. A product of a freshwater single-celled green algae called Euglena gracilis may enhance skin regeneration to speed up wound healing, according to new research published in Advanced Materials Interfaces. Euglena gracilis, an adaptable phototrophic protist, has recently become a fascinating prospect for research that is driven by applications and for commercialization. Protein, unsaturated fatty acids, wax esters, a special 1,3-glucan termed paramylon, and other important substances are produced by this photosynthetic protist. Posoleucel, an investigational allogenic off-the-shelf T-cell therapy that simultaneously targets 6 different viruses, demonstrated promising antiviral efficacy and safety in a phase 2 study of patients who had undergone stem cell transplantation to treat their cancer or other blood diseases. In this trial, the researchers evaluated the safety and efficacy of posoleucel. The trial enrolled 58 adult and pediatric patients who had undergone allo-SCT to treat cancers or other diseases of the blood and had infections of at least one of the 6 viruses that posoleucel is designed to target. Eligible patients were either unresponsive to or unable to tolerate standard therapies for these viruses. In total, there were 70 viral infections in the trial population, the majority of which were CMV and BK virus infections. Cambridge scientists have successfully trialed an artificial pancreas for use by patients living with type 2 diabetes. The device, powered by an algorithm developed at the University of Cambridge, doubled the amount of time patients were in the target range for glucose compared to standard treatment and halved the time spent experiencing high glucose levels. Researchers have developed an artificial pancreas that can help maintain healthy glucose levels. The device combines an off-the-shelf glucose monitor and insulin pump with an app developed by the team known as CAM-APS-HX. This app is run by an algorithm that predicts how much insulin is required to maintain glucose levels in the target range. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.